Hello, everyone, and welcome to this session, which will be all about communicating effectively with your healthcare team. I am Dr. Carol Wada. I am a board certified pediatric and adult allergy, immunology, and lifestyle medicine physician. But about 2 years into my medical practice, I was diagnosed with Sjogren's and have also dealt with some dysautonomia issues as well. And I am joined here today with Juana Mata. She is a patient advocate and founder of Looms for Lupus. We are so thrilled that Horizon Therapeutics is sponsoring this session, and we're excited to have this conversation today about how we can make the most of our medical visits. I'll let Juana introduce herself as well.
Hello, everyone. Like Doctor said, I'm Juana Mata. I am a co-founder from Looms for Lupus. I was diagnosed with lupus, rheumatoid arthritis, Sjogren's, and other autoimmune conditions in 2009. But honestly, I do truly believe that. I had these problems way before I was diagnosed, but I'm a patient advocate and I'm always happy not only to share, but also to provide support and get support from others.
So, we wanted to kick off this conversation in part by talking about a concept that comes up within discussion about the medical establishment and medical field. So, when we think about the relationships between patients and physicians for many, many years, it was kind of this idea of the doctor as God and then the patient just kind of following, very paternalistic in nature. And over time, that evolved maybe where the doctor was down to like superhero level. And I think where I am really excited about and looking forward to is this paradigm that is termed Wellness 2.0. And there's a lot to this paradigm, but it's the idea that as physicians and healthcare professionals, that we are human and that we are partnering together as a team between someone who has that education and training in the health sciences, but then also the patient who's expert in their lived experience. And so we're going to at least start off this conversation. And I wanted to ask Juana, what are some of the tips that you like to share when thinking about going to your next medical visit?
Yeah, well, one of the things that I first want to say is that, like you said, communication is the key. It's not only just, speaking and asking what you want, but also listening to your provider, to your doctor. Like you said, you are the expert. You are the expert, you're the doctor, but as patients, we are the experts in our body and what we feel. Now, one of the things that I always say that it's so important to when you go have a visit or when you have an appointment with your provider is to always be prepared to not only understand your body, understand your numbers, because as the doctor, you are so limited in the time. So being prepared is so important, you know, um, and understanding that a lot of the times you might not be able to ask the 20, 30 questions that you have, but being prepared with the three most important questions and being ready would actually be more productive in getting the answers that you need as a patient.
So how do you prepare as maybe you have a visit, we'll pretend like coming up next week, what would you be doing and recommending to others as they're thinking about their next visit too?
Right. Well, one of the things that I always talk about is, of course, like I said, be knowing your numbers, knowing and understanding your body, but also keeping a journal. Keeping a journal and taking that journal with you, and making your notes, taking your notes, and sharing with your doctor, painting a picture to your doctor what your symptoms are and what you're there for. So having the journal will be very, very important because you can, have that information provide that information to your doctor, like, hey, when I wake up in the mornings, my hands are stiff. Painting that picture to your doctor will be very important for your doctor to understand how to work with you to give you the care that you need.
I can't agree more on both sides of the coin, and I want to just point out a couple, bring to what I hear and see on my side of the exam room when I'm in the physician role. Painting that picture is really important because it humanizes you. We
Yes.
know that, about 62% of physicians are clinically burnt out. They may not be as engaged as we would ideally like them. And being able to share that lived experience and how your symptoms are affecting you may help in communicating, the need for more immediate action.
Mhm.
The other thing that I realized when I'm in the patient role is I have this tendency to go into kind of fight or flight mode, but instead of fight or flight, I freeze. And even though my rheumatologist is one of the nicest people on the planet, I, consider her, a colleague as well, and we're about the same age and out of training. There shouldn't be that power dynamic, but I still get really nervous. And so having my notes with me with those questions that I have in mind, and a
Mhm.
reminder that I don't need to just go into people pleasing mode of like telling her everything's perfect when it's really not, is helpful for me too. So, yeah, I am totally on board.
Def-
Yeah.
Definitely. And maybe a lot of the times, as patients, it is so difficult, especially if you have, like for me, I have the lupus fog, the fibromyalgia fog. So I tend to forget. So one of the things that we always talk about, or I always talk about when I hold support groups, is take somebody with you. Take your, somebody, your care partner, your a close friend that you trust that can not only remind you of the questions that you have, or possibly taking notes for you, because a lot of the times as patients we're so overwhelmed in all that we have in our mind that we forget or we don't take good notes. And making sure that taking the notes and understanding what your provider is telling you is important, because at the end, you're gonna need to follow what the doctor is saying, because that would help you with your with your health, with your quality of life.
Yeah, and I think that goes to something that I like to do at the end of visits, but maybe, every doctor practices medicine a little differently, right? And there's this concept when we talk about communicating, and it's called closed loop communication. So I think it's really helpful to recap that game plan before you leave the office. What are you going to be doing as a patient? What is the doctor or the office going to be responsible for? And then also just checking in, how are we going to communicate, or will we communicate between visits? Kind of what does that next step look like? Because every office is going to have a little bit different style or guidelines when it comes to communicating between visits too.
Right. Well, I mean, just making sure that, like you said, at the end of the visits, um, usually as patients, we do get our notes from the doctor, what we talked about. But a lot of the times as patients we do tend to forget. So just making sure that you before you leave the office, you do get your notes, what the plan is, what the plan you and your doctor um, have for until the next visit. So it's important to always make sure that you do have not only the plan, your notes, but also to make sure that you have that communication with your doctor, because understanding, or both your doctor and yourself being in the same page, understanding exactly what the plan is, will actually be better for you and follow um, as patients, you'll be able to follow more if you and your doctor come together with that decision and you both have that in your notes. The patient will actually, or as a patient, you will tend to follow more what you both came planned together.
So we talked a little bit about kind of knowing our body and our numbers. One trap I think I see some patients fall into that I like to share is, we have these awesome electronic medical records, and truly they have changed how we practice medicine. I'm old enough to have trained back when we actually had paper records still. I'm like that last generation that did that. But the average patient, which I would say most of us here are totally above average in the best way possible, myself included, but the average patient generates 40,000 pages worth of medical record data every year. And so when I am trying to look up a key piece of data, maybe a lab result or an imaging result or a note from another specialist or your primary care doctor, it can be really hard when we're in that time crunch to find that when we're at the visit. So, I know we talked ahead of time, but what do you do to help streamline this and to make things easier on yourself and your team?
Right. Especially as patients with, as a patient with multiple conditions, not only do I have, my primary provider, I have a rheumatologist, hematologist, rheumatologist, and I'm lucky enough to have electronic health records, and all my doctors share those electronic health records. Not every patient has that luxury of having, the electronic health records shared with your providers. So it is very important to keep a journal, or if not a journal, keep a binder with your results, with what your one provider, one specialist gives you. Always have it with you in that binder, because when you do end up going to another provider, you have that tangible information that you can provide, because if that provider doesn't have the electronic health records to look at, then you will be prepared by having that with you. Just making sure that whatever prescription or whatever medications you're taking, you have in that binder, because one thing is that, again, without electronic health records, or if they don't share the records, it might be a little difficult for your doctor to come up with a plan with you for your medication, or uh, or the plan that you will have with your doctor to go home with.
I think the other thing other I guess, catch with electronic records and to be mindful of is that there is a tendency, especially in a system that's crunched for time, for us to carry things forward. So in most of these, electronic health system records or record systems, there's an ability to carry things forward. So if information is incorrect, that can be passed forward and sometimes missed, or we can make decisions based on incorrect information. So that's another reason I think to add to your point of getting copies of those records, being familiar with them, asking questions. And then I have had patients kind of reach out to me and say, hey, through the portal or at the next visit, hey, Dr. Wada, I noticed this was on my chart. I wanted to let you know that this isn't correct. And I'm like, oh, thank you for letting me know. Let me get that fixed, so that isn't passed along and perpetuated in the system too.
Yes, so it is super important. As a patient, I can tell you from the beginning, I have always kept my records, because, sometimes it is difficult for the doctor to also, even if with the electronic health records, for the doctor to go through like the long history the long history. As a patient, I've been diagnosed with all these conditions for 13 years. So imagine the doctor having to go through all of that. But if I have something on the top, something that is important, something that you might, as a doctor, might not be able to see right away. Like, for example, I'm allergic to this medication. Maybe it won't come up on the top, but if you have that and you make sure that you have that annotated, or you have that highlighted, and provide that to your doctor, to the new doctor, or the doctor, I mean a different doctor, then it is important to always have that with you.
So I think one of the questions that came up in some of the chats yesterday were, what do you do if your healthcare team, your doctor doesn't believe you? If you feel like you're being, gaslit, medical gaslighting is kind of a really common topic of conversation, and rightfully so, within our invisible illness and autoimmune communities. Um,
Uh, as a patient, I can say, when I was diagnosed with lupus, I was dismissed, but being your own advocate again, one of the things that I always say, you're the CEO of your body. You know what when something is not right, and just advocating for yourself. Talking to the doctor and letting the doctor know why you think you're feeling this way, or just again painting that picture of your symptoms. And advocating for yourself is the most important thing, and not um, forgetting that yes, the doctor is the expert and we have to respect, but also just voicing out your concerns about how you're feeling. And of course, I always say, if you are not getting the proper care from a provider, as a patient you have the right to ask to speak to a different doctor.
mhm. I totally agree. And one thing I will pass along to folks, we kind of talk about red flags and green flags. One of the green flags I tell folks to look for is look for a healthcare professional who's happy in their job. I think that's usually a good sign that they're, if the going gets tough, or you as a patient aren't reading the textbook, that person's going to have a little bit more bandwidth to lean in and get curious and lead with compassion, as opposed to kind of shutting down and just bouncing you to the kind of the next referral. I think the reality is that as healthcare professionals and as patients, we are both trying to function within this very dysfunctional system. We kind of heard all about that in the advocacy session just prior to this, and in the chat as well. And I think, you know, when reasonable, giving some grace is helpful, on the other side. We are, as a physician, I am human. I'm pretty open about my own health issues, but others, have every right to be more private with those. And so we sometimes do have bad days. And yet we also still, kind of had that oath to do no harm as well. And so, there's that balance of and nuance between our communications together, um, that's really hard. I think part of what I encourage people to do to some degree is we all have to get, all of us on both sides have to get a little uncomfortable, or comfortable with getting uncomfortable, until we can make some forward progress in our healthcare system.
Absolutely. And, just reminding, as patients, reminding ourselves that, the doctors are human just like we are. And, there's going to be times where, the doctor is also having some struggles. So we have to understand that, yet, being respectful and talking to the doctor or provider, and, just voicing our concerns. And, I think that that's the key: communication, 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 and not only paying attention to what we want to hear, but also understanding and asking questions. And you and your doctor, we're a team. We're a team. We're supposed to be working together.
How
And
Oh, sorry.
no, go ahead.
I was going to say, how wonderful if we both could come to that conversation with the ability to lean in and be curious um and compassionate towards one another. I know
Yeah.
that's kind of pie in the sky. given the current circumstances. But I think that's where some of that magic of healing sometimes happens.
Right. I mean, again, just the communication is key, and just making sure that as patients, we are cleared in how we're saying our what we're going through or what we're there for, but also listening and understanding to your provider. And if you have questions, asking the providers, I'm sure, or doctors are going to be happy to know that as a patient you want to work, and you want to make sure that you understand the plan, that you understand what the instructions are, because at the end we're both working together for our health.
Yeah. And I would say if you're not getting that, that would be another one of those red flags to watch out for.
Mhm.
One thing that I had a patient share with me that I now like to share with others too, because I thought it was so vulnerable and also so helpful. Um, they came into the visit. They had seen many other doctors and healthcare professionals before coming in to see me. And they shared that they were nervous about the visit because they had not been treated well by the medical system, and that it took a lot for them to make that appointment and to come in. And that they were hoping to partner with me in their care. And
Mhm.
I've actually taken some of that and kind of reversed it now when I see patients that I'm getting hints and, from their story that they've gone through trauma related to their interactions with other clinicians or healthcare procedures or what have you, maybe ICU, admissions, that I am there to partner with them and to also let them know if I don't know what's going on. Um, my hope is that we can continue to
Mhm.
engage on both sides of that. Yeah.
Right. Well, I can share my experience. The
Yes.
day I was diagnosed, the doctor did.
Juana's
I
joining
can.
us from the hospital. Yep. So thank you.
Yes, sorry. Um, what I was going to say, when I was diagnosed, the doctor did look at me. He didn't believe that I was sick, yet I was critically ill. And one of the things is, like I said earlier, self advocacy. With all the respect, as patients, we need to also make sure that we communicate well with the doctor and always respecting them. To me, I think that's the key. And, and for the providers, I just ask that that they believe the patient. I don't know any other way how to say it,
Yeah,
because a lot of the
no,
times as
absolutely.
patients, we don't ourselves don't want to go to the hospital. I mean, we go because we have to as patients. So when we get dismissed, I mean, we do get
Mm,
that, where like, why even go if I'm not going to be believed? If they're not going to believe me, why go, right? So just making sure that you communicate, and you self advocate, and you share, paint a picture, and provide all that you can to your provider, so that you can work together.
yeah. That not being seen and not being heard or witnessed for your lived experience is so painful. I have just my slight brush with it in that my diagnosis story. So I had just had my second daughter, who thankfully hasn't joined us. She's home ill today. Um, but she was about 9 months old. I went for my dental checkup, and the hygienist told me my mouth looked dry. And that kind of was the last domino, or the domino to fall, to kind of put everything in place. And I had, remembered that my eyes had been dry. I had had a lot of back stiffness. And so I worked up some courage to make that appointment with my primary care doc. Again, someone I knew, someone I shared teaching responsibilities with, someone that was a peer. And when I went into that visit, it was with reluctance that she ended up ordering those labs. It was like, "Oh, I guess we can do that. I think you're fine. I think you're just tired because you're, a doctor mom," like, and it's easy for me because I know her. I have that established relationship to now kind of step outside and say, "Hey, she just wanted me to be well. She had good intentions in her communication, but me as the patient in that moment, it still hurts thinking back of that, like, that resistance for something that was so easy. Like, how hard is it to order a lab?" Right? Like, from my standpoint. And, I think it's with time and reflection of that experience that it's like, oh my gosh, I have so much privilege knowing what lab to draw, like having health insurance, having people's cell phone number, those sorts of things. And yet I still got this pushback. Goodness gracious, like, we have a real huge problem on our hands.
But again, being your self advocate, can
Mhm.
actually save your life.
Yeah,
For me, that's what
did save your
happened.
life. Yeah,
Yes, yes. And just, as patients, we have to learn that we have the right.
yeah. So we are coming up to kind of the close of our session. So maybe we can kind of summarize a little bit about, everything we've talked about. We've covered a lot, and kind of hit the high points of
Mhm.
preparing for a visit.
Uh, Preparing. Oh, okay. So,
Yeah.
in my opinion, I think, just always being prepared, knowing your numbers, bringing somebody with you if you need the help, um, keeping a journal and painting a picture to your doctor about what you have been going through prior to your appointment or why you're there.
Mhm.
Um, uh, Bringing not only the journal, but also making sure that you have a list of the medications that you're taking. And if you have a provider outside or not close to your doctor, then bringing not only the phone number, the name on all the
Yeah,
information is
huge.
key. Yes, so that's very important. And just, understanding your body and uh, having that communication with your provider is important. um, let's see, I mean, there's a lot. I mean, I wish we had more time, but I
I
mean, there's
know.
so many things that that we can do to prepare ourselves before going to our doctor. But mainly, just being prepared and taking somebody with you if you need to take,
I'll have one little last thing. I think, no one realizes when you call to schedule that appointment, you can ask how long those appointments are scheduled for. That may give you a ballpark of kind of the time frame you have. If you are someone who has a more complicated history, you can ask if they ever have longer appointments. Worst thing they can say is no. But that's something that can be helpful, I think, on both sides, because that time pressure is hard.
and I just remembering that your provider, your doctor, is also human, and they deserve the respect. And that we're just going to be working together. We're partners in our health. I mean, we want to just be together and come up with a plan so that we can be better.
Mm. This has been great, Juana, and I hope this is just the first of many conversations we get to have together. Thanks so much.
Thank you.
Yeah, thanks so much to Horizon Therapeutics and the Autoimmune Association for allowing us to have this conversation and sharing it with all of you.
Thank you. Thank you. It was great having this discussion.
Come follow us on Instagram in the meantime. We'll keep it going.
Definitely.